welcome everyone. I'm Dennis Stone, Director of the Center for Advocacy and Social Justice at the Urban League, which is hosting this program. And I'm very grateful for Giese and the work she did. She actually realized what was happening with 988 and took the ball and ran with it. So very grateful, and for help from all of our interns, including Jamie Krasnogor, who is on with us, and Julie Miller. So welcome everyone, and on behalf of the Urban League, we're grateful for all the work that you're doing. So thank you.
Gayle Giese. She is from the Florida Mental Health Advocacy Coalition. And then we also have Suzanne Mailloux. She is from NAMI Jacksonville. And so to get us started, I'm just going to show everyone a little video to introduce what 988 is rather than me trying to explain it, just because it'll be a little easier.
Imagine for a moment that a fire breaks out in your home. And in this reality, 911 doesn't exist. You might call the fire department directly, but they're not equipped to come to your location and only put out fires at the fire station. And the only people that will come to you in the community are the police, who, though well-intentioned, are meant to provide a very different type of public service. This lack of a fire-specific response seems ridiculous, right? Of course we should have targeted services to respond to life-threatening emergencies, whether that's fire, law enforcement, or physical health. However, in many communities across America, life-threatening mental health and substance use crises are treated as an afterthought, receiving a response that's not specific to their unique needs. A 911 call dispatches the police, who most often bring the patient to a medical emergency room or jail, or allow them to remain in the community but without assessment, treatment, or support. We have a patchwork system, made up of elements designed for other purposes, that doesn't have the capacity to treat the most vulnerable in our communities, even though an estimated 20 to 25,000 individuals in crisis go to emergency departments every day in the U.S. So how can we improve? The only solution to delivering crisis care worthy of our communities is to build a structure specifically for mental health, substance use, and suicidal crisis that is on par with other emergency systems, like we do for medical, fire, and law enforcement. By integrating 3 core elements, we can replace the patchwork fabric of our crisis care and develop a true safety net that can serve everyone, everywhere, every time. And in the process, we can reallocate wasted financial resources to places where they can have a deep community impact. It starts with regional or statewide crisis call hubs. Call, text, and chat lines staffed by trained professionals who answer the call every time and direct people to the level of care they need. The onset of 988 is a great start. However, it will need to be supported by technology that empowers 988 to become an air traffic control for mental health and substance use crisis, enabling real-time coordination across the care spectrum. But a comprehensive crisis network cannot be built with only crisis call hubs. Additional services are necessary to ensure that a unified system of care is available when and how people need it. Services like mobile crisis outreach teams, 24/7 non-law enforcement mobile teams that go out in the community and deliver care to people wherever they are. This lessens the burden on law enforcement during situations where they're not needed and eliminates the anxiety people feel when a uniformed officer knocks on their door. And facility-based crisis receiving and short-term stabilization, facilities that say yes to every person that walks through the door, regardless of their level of need, allowing them to bypass the medical emergency departments. This not only provides specialized care to these individuals with less waiting, it also enables medical emergency departments to focus on the patients they're trained to serve, while drastically reducing wall time for police when transportation by police is warranted. With these core elements in place, mental and substance use healthcare can move out of the shadows and into the mainstream. Together, we can build an unbroken system of care that connects patients from the point of crisis to the level of care that's right for them. To learn more, visit crisisnow.com.
All right, so that was just a little bit about what 988 is. Next, I want to introduce you to our first speaker. So our first speaker, as I mentioned before, is Gayle Giese. She is a board member of NAMI Florida and a founding member and past co-chair of the NAMI Advocacy Group of Broward County. And she's currently the president of the Florida Mental Health Advocacy Coalition, which she helped to found. Currently, she leads the state 988 advocacy group and serves on the state's 988 planning coalition. She's passionate about helping those with mental illness and their families and speaks openly about serious mental illness within her own family. She advocates to provide safe, affordable, permanent, supportive housing, insurance parity for mental health services, certified peer specialists, and more and better funded FACT teams. First, psychiatric treatment beds, and an effective and appropriate behavioral health crisis and access system, and integrated healthcare. In 2019, she won an EPIC award from Mental Health America of Southeast Florida. In 2020, she also wrote a grant that led to SAMHSA providing sequential intercept mapping workshops for Broward County to kick off the Stepping Up initiative and to reduce the number of people with mental illness in jails. And she chairs the Committee on Pre-Arrest Jail Diversion. Please welcome Gayle.
Thank you so much, Jesse, and thank you, Dennis. It's great to be here with you all tonight. I'm just going to share my screen. I have a PowerPoint presentation, and then I think later we'll do some Q&A. So HOPE has a new number, 988. 988 is really transformative because it takes us away from the criminal justice system and provides a behavioral health response that provides the most help possible for the person calling, whether it's the person that's calling for themselves or a family member. So a little bit about FLMHC. I'm the president of the Florida Mental Health Advocacy Coalition. You are welcome to join us. We connect you with your local advocacy groups. And our mission is to improve the lives of people and families affected by behavioral health conditions in the state of Florida. We work with legislators all over the state. We have 31 different member organizations or local advocacy groups, such as NAMI Broward County. I see Dr. Sandra Humper on the call today. Thanks, Sandra. And we added another 7 in the last year. So what is 988? It's the new nationwide phone number for suicide prevention and behavioral health crises. And it's also a veterans crisis hotline. That actually has not changed. You could already reach the veterans crisis hotline through 211. It was created by a federal law, the National Suicide Hotline Designation Act of 2020. It was activated just this past Saturday, as Jesse mentioned. Calls to 988 are directed by telecommunications companies to Florida's 12 national suicide prevention Lifeline call centers. 988 does not replace 911, but it's a supplement to 911. It's another option, relieving police of about 20% of community responses. And we get that figure of 20% by looking at systems that have already been in place for over a decade, such as Georgia's Crisis and Access Line. So instead of bringing a police response, when you call 988, you'll be talking to a trained counselor, someone who has been trained to deal with mental health or substance use issues, or suicidal ideation. It's really a game changer for families that don't know what to do when there's that first psychotic episode, or someone having a panic attack, or someone talking about taking their own life. You can call 988 and get the help you need, and it's confidential too. So let's say you're a teenager and you don't want to talk to your parents. You can call 988 and speak confidentially. The 988 centers, call centers, are National Suicide Prevention Lifeline centers. They are well trained by the American Academy of Suicidology, and they can de-escalate a situation, and they can provide counseling, and they can link you to services. And they can do that the first time you call. So instead of searching and wondering who to call and where to go, and maybe spending years trying to get treatment and suffering trauma maybe going to an emergency room or being in a Baker Act facility. You can get the help you need right away, probably when it's easier to get the help and when the help provides a better prognosis. When I first heard about 988, I was ecstatic because my story goes back 13 years when my son had his first psychotic break. And I didn't even know what a psychotic break was. Certainly didn't know who to call or where to go. So I did what many of us would do. I called a friend who referred me to a psychologist. And it was a psychologist who really didn't know what was going on either. But he took my money and 6 months later referred us to a psychiatrist. And at that time, my son decided he wasn't ill anymore and he wasn't going to take any medications. So we suffered for several years. What helped us the most was actually NAMI Broward County. I found NAMI and NAMI referred me to the right services. But imagine if I'd had 988. I could have called 988 and I would have described what was happening with my son, that he couldn't tell the difference between what was real and what was not real, that he was extremely frightened, that he had been having panic attacks and was pacing around the pool area. If I had said that, the call taker, the trained counselor, would have known what was going on and could have referred me perhaps to a first episode psychosis program, which would have been a wonderful resource for my son and for our family. He would have gotten the help that he needed and possibly been able to go back to school. He was a senior in high school when this happened. So for families like mine, this easy 3-digit number is an absolute lifesaver. And we'll talk a little bit more about how it also saves a great deal of money by providing the right service at the right time. I did want to tell you another little personal story about the second time my son had a psychotic break. And it was only about a year later than the first time. And I thought, this time I'm going to do the right thing. I'm going to call 911. And I had heard about a Baker Act, so I'm going to try that. So I call 911 and an officer comes to the house and he brought handcuffs. He didn't know what was happening with my son. He didn't understand at all because he wasn't trained in mental health. And so my son touched me on the shoulder and the officer said, "Is he pushing you? I'm going to charge him for that." I was like, "No, he just needs help. Please just get him the help that he needs." Well, then the handcuffs came out and it was the middle of the day and the officer walks my son out of the house and everybody in the neighborhood's watching. And my son gets put in the back of a police car. And I'm thinking, this is not a crime to have an illness. This is a medical illness. This is not something you should have to be handcuffed for. And he was taken to a Baker Act facility, which is a locked facility. It's very much like being in jail. Fortunately, not for very long, usually for just 72 hours. So that was a pretty awful event in my life and my son's life especially. And it caused quite a bit of trauma, so much so that he didn't want to ask for help or treatment because it had been a traumatic situation. So what are we doing within the Florida Mental Health Advocacy Coalition to support 988? We've been working with the Department of Children and Families. I've been on the DCF Planning Coalition for the state since April of 2021. And we've been meeting with the Lifeline call centers to make a plan for Florida to implement 988 and to be ready for 988. But Florida Mental Health Advocacy Coalition has taken it further, and we're actually working within communities. So we have advocates in many different areas of the state. Suzanne Mailloux from NAMI Jacksonville is working very hard in the Northeast region in your area. And I work with Broward County. So we work with our managing entities, our National Suicide Prevention Lifeline call center leaders and behavioral health providers, county commissioners and city leaders, and in order to work together to make not only 988, but the whole crisis care system improved, to make it a success so people get the help they need the first time they call. You may not know what a managing entity is. When I first started advocating for better behavioral health in Florida, I did not know either. There are 7 managing entities in the state of Florida. They're not-for-profit organizations with community boards that oversee Florida's safety net population. Those are the people who are uninsured or underinsured. They work with community stakeholders to tailor the funding and the services to fit each community's unique needs. When Suzanne got the ball rolling up in Northeast Florida, she was fortunate enough to connect with Melanie Patz, Social Responsibility for Baptist Health. And Melanie convened a lot of stakeholders. I think it was about 75 people to form a task force. And they've done amazing work to improve the behavioral health systems in your area. And they have plans for many years going forward to continue to improve. And I believe that they plan to continue to meet. So you saw this in the video. I love the screen. 988 is great, and it is the start, but it's just the first piece. It's that 24/7 crisis call hub visual that you see. We also need someone to respond, mobile crisis teams, and we need them throughout Florida. And we need crisis receiving facilities, such as centralized receiving centers that anyone can walk into. Also, law enforcement can drop off there, which is pretty cool. And they'll keep someone for up to 23 hours to assess them, to stabilize them, and to link them to services. So that's somewhere to go. So let's talk about funding for the Lifeline call centers, because it's just imperative that the call centers have enough staff to answer the phones quickly, and they have the infrastructure to make the system work effectively. We do have some funding in Florida. That's the good news. And some states don't. So we're a little bit ahead of some states, but we don't have as much as we believe we need based on the increases that we expect in the calls and the texts. You can call or text 988. So what do we have? We have some federal funding in the state of Florida. We have $5.2 million from a SAMHSA grant that's over 2 years. Now, it seems like an awful lot of money, but it's got to go out to 12 National Suicide Prevention Lifeline call centers over a 2-year period. And then the Department of Children and Families needs to take a small piece of that in order to administer the grant. And then there's $8.4 million from the Supplemental Mental Health Block Grant. And fortunately, that will recur in 23 and 24. And that's going out to the call centers. Most of the call centers will see this money in August. So keep in mind, they need to be hiring staff, and they need to be ready to take all of the increases in calls. And that's why we're using the term soft launch. We actually don't want a lot of advertising for 988 right now. We want to raise awareness, and this town hall is certainly doing that. So thank you for being here. We want to raise awareness and educate the public, but we want to gear up. We want to get those call centers ready. We want to get the mobile response teams ready. And we want to make sure our crisis stabilization centers are ready to help people as well. So speaking of mobile response, the Florida state budget included the largest increase in recurring behavioral health funding in decades. So that is certainly to be celebrated. And that is $126.3 million to the 7 managing entities to oversee in their areas and enhance FACT teams, that's Florida Assertive Community Treatment Teams, for people who need a high level of care but can still live in the community, people with serious mental illnesses. CAT teams, that's pretty much the same, but for children. FIT teams, family intervention teams, and mobile response teams. And of course, that's why I listed this on here. We want some of this $126.3 million to go toward making sure that we were able to provide a really good mobile crisis response everywhere in the state. So this funding is also available now. It became available at the beginning of the fiscal year, which was July 1st. Our coalition submitted a preliminary report to the state's Mental Health and Substance Use Commission on mobile response teams based on a survey of the 39 Department of Children and Family funded mobile response teams in the state, and all but a few replied. We got some really good information. All of the leaders of the mobile response teams were wonderful and responded to our survey, which was very lengthy. And we found that there were some mobile response teams that only served ages 25 and under. That was actually true in your area, but your area has recently expanded their MRT. I'm not sure exactly when that will take effect or if it already has, but expanded it to serve all ages, which is wonderful. And that's something the task force was working on with Suzanne. So that's terrific. But we want to make sure that throughout the state of Florida, all of the mobile response teams will serve all ages, not just ages 25 and under. And just a little history on that, the 25 and under mobile response teams came about as a result of the Marjorie Stoneman Douglas Parkland tragedy. And there was a bill passed that year that established mobile response teams in all counties, but only for ages 25 and under. So at this point, with 988, we are pushing for all of those to expand to serve everyone. Some mobile response teams are called co-responder models, and the co-responder models usually have a law enforcement officer with a behavioral health professional. And some mobile response teams must cover very, very large geographic areas. Dennis mentioned that Jacksonville is a very, very large area to cover. And some of the mobile response teams include certified recovery peer specialists and some don't. We'll talk about SAMHSA's guidelines for mobile response teams and what they really should cover, what we want them to cover. So mobile response teams are community-based intervention wherever you are. So they come to you. You could be at a shopping mall, or you could be at your home, and you can call for a mobile response team, or you could call 988, and 988 can dispatch a mobile response team. Hopefully when you call 988, and this is true for most of the calls, about 85%, they can de-escalate and provide counseling and get you the services you need without needing to send anybody. But for some people, they will need an in-person response. So SAMHSA recommends at the very minimum that there be 2 people on a mobile response team, 2 people that are behavioral health workers, and that emergency medical services should be aware and partner as warranted with the mobile response team. They should be available 24/7, and they should connect individuals to facility-based care through warm handoffs and coordinate transportation if warranted. And then the very best practices would be to incorporate certified recovery peer specialists within the mobile crisis team. Some of you may not know what a certified recovery peer specialist is. A peer is someone who has lived experience with a substance use disorder or a mental illness, or they could also, there are family peers, and then there are peers who have experienced behavioral health issues themselves. And sometimes it's these certified recovery peer specialists who are certified by the state. They have to pass an exam and get credentialed. Sometimes they're the only ones that can really relate to another person who is experiencing a mental health crisis. So or a substance use crisis or a suicidal crisis. So peers are very important. Sometimes they can go with someone who is being transported. They do that in some other states, and support the person and advocate for the person and be a role model and provide hope. So another best practice is to respond without law enforcement unless special circumstances warranted. This is in order to support justice system diversion. The last thing we want is for someone to overreact and lash out against an officer and end up in the county jail. It's not what we want. We want a situation where the person feels safe, where they're not traumatized, they're not afraid of someone who might be there in a uniform with a gun and handcuffs. Another best practice is to implement real-time GPS technology so that you can find someone really fast and track them to get there as quickly as possible. And another best practice is to schedule outpatient follow-up appointments to support connection to ongoing care. So in the state of Florida, we have a lot of mobile response teams, and they don't all do the best practices. So I encourage you to work with your behavioral health advocates in your area and improve mobile response. I am very proud of the ones in Broward County, but even so, we're always looking at the data, and we're always trying to improve the response. You don't want to be critical. You want to work with them in a collaborative way and help them to provide the best response and advocate for them to get funding. So talking about funding, how about potential funding for 988? We know we can leverage Medicaid dollars. Right now, there's an 85% match that's available through the American Rescue Plan Act. It will continue to be available for about another 4 3/4 years. And it will cover 85% of the cost for up to 3 years. So states have to apply for that. Florida has not applied yet. It would be up to AHCA, the Agency for Healthcare Administration, to apply for that match. There's also opioid settlement funds that have gone to counties and to managing entities. And some of these could be used to support crisis response, particularly for substance use crises. By tracking data, which is something that is being done by our National Suicide Prevention Lifeline centers, we can then take that data to the state and advocate for funds to address increases in calls and texts. It's been proposed by some states, including Florida, that there be a license plate created that would bring in some funding for 988. And then some states have passed cell phone fees in Washington, Colorado, Nevada, and Virginia. And these are less than $1. Actually, they're really small. Some of them are like 11 cents. And that's just a monthly fee that would be on your cell phone. That would fund 988 services. 911 is funded by cell phone fees. I am told, however, that this is unlikely to pass in the state of Florida, but we can keep trying. So there are federal bills such as the Restoring Hope for Mental Health and Wellbeing Act that is currently in the Senate Committee on Health, Education, Labor, and Pensions, and it has passed the House, and there is some funding associated with that bill. So we're following it closely. Our highest priority is to support an effective and compassionate 988 crisis response system. I've given you many reasons why, but I want to give you another one. It's quick access to a behavioral health system that otherwise is hard to navigate. So you call 988 and you don't know what to do, and you're immediately in the system. You're talking with someone who has a database of all the local resources. So you can sign up for our legislative updates and action alerts on our website, so you'll know what's happening at FLMHC.org, and we'll help you communicate with your state representatives when critical votes are to be made. You can get involved and join your local advocacy group. There's one starting at NAMI Jacksonville. I want to stress collaboration between 988 and your National Suicide Prevention Lifeline call centers. your 911s and your behavioral health providers and your county and city leaders. Thank you so much.
Thank you, Gayle. That was a great presentation, and it really gave us a good background on what 988 is, where it's looking to go in the future, and how everyone else can also get involved to try to get that going. I want to introduce our next speaker, Suzanne Mailloux. She is the executive director of NAMI Jacksonville. She is an attorney with over 20 years of experience in business and technology law. She graduated from the University of Florida with a JD and a Bachelor's of Science in Psychology. During her life journey, she was faced with a mental health crisis with a loved one who struggles with mental illness, leading her to redirect her passion, career, and caregiving to support her loved ones and others challenged with mental illness. Through her compassion for others and sharing of her life experience and bringing awareness to her challenges of mental health care, she hopes to help tear down the stigma surrounding mental illness and bring awareness for the need of communities to help those living with mental illness. Suzanne has also been working to prepare Northeastern Florida for the implementation of 988 through her work with the 988 Task Force, which works with behavioral health providers in the area. Please welcome Suzanne Mailloux.
Thank you, Jesse, and thank you to the Jacksonville Urban League for inviting Gayle and I here. We are so pleased that you are bringing awareness to 988 and what that means for our community. So we appreciate you putting together the Town Hall Center. And I just wanted to say that I have the privilege of working closely with Gayle. She's been an incredible advocate. Gayle and the whole Florida Mental Health Advocacy Coalition. She's a great convener of information and helps us advocate across the state. Being a part of her meetings and the Florida Mental Health Advocacy Coalition has given us the tools to really advocate here in a local level. So I appreciate all the work that they have done, and so pleased to be able to work with her. So I'm going to share my slides as well. So I just want to talk a little bit about 988 and that it is available nationwide, which is an incredible first step for our community. But the services that surround 988, that work has just begun. And I am so pleased that I can be an advocate and be a part of that. NAMI is committed to advocating for efforts to create an ideal behavioral response system. And we believe that everybody in crisis and their families should be connected to care that provides a dignity and response that is timely. And that includes a continuum of a crisis and care, which is 24/7 call centers that are answered locally by trained counselors here in our area, crisis stabilization units and mobile response teams that Gayle talked about a little bit. And we're hoping that through this vision that we can end the revolving doors of arrests and homelessness and ER visits and incarceration. So 988 is available now. As you all mentioned, this past Saturday was the soft launch, if you will, of the phone number. But what does this mean for our families here in Northeast Florida and the rest of the state and the rest of the nation? So we have an easy to remember phone number, which is incredible, 988, and it will help more people access crisis stabilization and crisis care quickly, which is great. And the number actually expands the original National Suicide Lifeline prevention number, and it expands it to not only individuals who are experiencing a suicide crisis, but any mental illness or emotional distress, or families who are calling on behalf of individuals. And this comes from the SAMHSA frequently asked questions about 988 and what it is serving and what its purpose is. And so while the number is easy to remember, it's important to know that we need a response that's going to provide mental health response, an appropriate mental health response. So everyone who experiences a mental health condition in a crisis, we believe that there should be 3 pillars that creates this response, and that is someone to talk to, someone to respond, and somewhere to go. And so NAMI is actually, NAMI on the national level and all of the 650 affiliates across the nation is urging policymakers to invest in a crisis response system so that people have someone to talk to, someone to respond, and somewhere to go. And all calls, they believe, should be answered by people who are locally trained counselors here locally so that they can connect them to local services versus having calls being sent across the nation that don't have the access to the local services. We believe that these de-escalated calls should provide more than just the de-escalation when the phone call is over, but rather have a response by mobile response teams should somebody need help beyond just the telephone call. We know that the behavioral health crisis and that immediate need might be de-escalated, but there is often underlying behavioral health or mental illness that needs a wraparound service and more care. So having someone to respond would include many of the models that Gayle included, but having a mobile response team to be able to go where you are at the time that you need it is a key piece of the puzzle. And then beyond that is having somewhere to go should the mobile response team go out and de-escalate further, but having somewhere else to go, because sometimes people in a mental health condition, mental health crisis, need more support that can be offered either over the phone or through even a mobile response team. And so these teams in the crisis stabilization services can help people have a longer recovery quicker and a longer period of recovery. And so locally, while it was a federal mandate, the localities are really left to build their response on their own. So on a state level or even down to a community level, we're left to determine what the response system will look like and what that implementation will look like. And in Northeast Florida, through NAMI Jacksonville and some of the advocacy efforts that we have done, along with so many community partners, we have created a Northeast Florida 988 task force. We believe that we can help build 988's response here locally. And we are trying to determine what that will look like for our community, what our needs are in our community. And we have been meeting since January of this year. We meet with, as Gayle said, almost 70 community behavioral health partners across Northeast Florida and our 5 counties. And we've been meeting regularly to discuss and understand what that will look like here in Northeast Florida. We knew that the implementation would be coming fast. And so we are looking at current resources that we have now that have been operating for many years that we can bring together and route those calls to 988 and route those services to the calls that are coming in. We knew that we could not implement our ideal, if you will, right away, but we are trying to leverage the work of the existing community services and the behavioral health responders to be able to respond to 988 now, since the number went live. And some of those partners are led by, like Gayle mentioned, Melanie Patz from Baptist Behavioral Health Social Responsibility Department, who has been great in convening a great number of people around Northeast Florida. And you can see I listed some of the key players here: Clay Behavioral Health, Child Guidance. And while I listed them all, they do come across 5 Northeast Florida counties. And I don't want to leave anybody out, but there's been some really important, great community partners here that has been meeting with us and trying to determine our response. So, as I mentioned, we are looking at existing resources, and we have these elements to be able to implement a response. And so now we're really looking at how we can envision an expansion of these services, if you will. So we have the elements available. It's just trying to learn how they are going to respond to the calls that are coming into the National Suicide Prevention Lifeline. So we have bi-weekly meetings, and we are all providing input and trying to really re-envision based on best practices. Some of the best practices come from other places in the country that have really implemented a wraparound behavioral health crisis service, which we have not done here in the state of Florida or Northeast Florida. So we're looking at some of those best practices and see how we can use our services here to map and mirror what they're doing in other parts of the country. We know that we need to increase our call center staff. It's been talked about not only in Northeast Florida, but not only through the state of Florida, but through the entire nation, that the call centers will need to increase their staff and they'll need to increase their training to be able to respond to all the calls. We believe that there is going to be an increase in calls to 988. We have talked about, and at local level, we have talked about mapping between 911 and 988. So currently many behavioral health calls come into 911, and we have people from 911 on the call who talk about how we're going to map and move calls between 988 and 911 until we're able to build the response that we really feel like we can handle 988 on our own, but we will always continue to have some collaboration with law enforcement to the extent that a call might be something that is a threat or imminent harm. We'll always be able to rely on 911 and law enforcement and then them to 988 behavioral health providers. So that's been a really key, important piece of the puzzle that we're working on. We've identified what warm handoffs will look like, what direct referrals will look like from the 988 call center, to the extent that we need to rely on peers to respond to somebody who would be more comfortable talking to a peer. So we've looked at what these would look like. We have, as Gayle mentioned, we have successfully advocated to expand MRTs to all ages. It has not happened yet, but at least it has been identified that Northeast Florida needs that. Currently, we only have MRTs that respond to up to age 26. And so as part of the calls that come in, we know that there are going to be adults and families that need a mobile response team to come out to them. So it's been a really great success that we've been able to acknowledge and haven't understood that we need to expand. So that just takes some time in terms of funding and contracts and things like that. But we are excited that that is and will be in the works for Northeast Florida. And we really feel like we've been a bit of a model to other localities in the state of Florida. We have just such incredible community partners, and you can hear their passion and their hard work and dedication to really respond to this. And so we believe that, you know, the rest of Florida can look to us, and we're happy to help to provide, you know, information on how we got together. But it really has just been an incredible collaborative effort between all of us. And so I'm just incredibly proud to work with them. So I wanted to talk a little bit about what 988 is and what 988 isn't. And I think it's important to understand, particularly at this stage in the process where it has gone live, but we haven't anywhere across the nation hasn't received the full amount of funding that is really necessary to build this reimagined crisis system that we want. So what it is that anyone can dial 988 to connect to the National Suicide Lifeline Network. And instead of using a 10-digit number, because that number has been live for many, many years, the National Suicide Lifeline Prevention Centers have taken behavioral health crisis calls. They have had trained counselors to de-escalate those calls. So that is the same situation that it's always been. It's just now we have an easier number to call, and they'll still be routed in the same way. The state is looking at different ways that it can be routed. I believe right now that the 988 calls are routed by area code, which potentially could be problematic because we all use cell phones and we transfer those cell phones. And so the state has been really great at recognizing and understanding that they need to be routed by county. And so I think that is a step in progress that they've made and will likely happen. Gayle may know a little bit more about that, but that routing is the routing is something that hasn't changed quite yet. What it is also is that it now is expanded to text. So you can text 988, which is great, which is another big step forward because not everybody wants to actually call and talk to people. So having a text resource is incredible. And then not only that, but it's been expanded beyond just the suicide prevention calls, but anyone with a mental health crisis. And this is important for families who can call on behalf of their loved ones, which is fantastic that it's been expanded to help anyone in really emotional distress. And so I want to talk a little bit about what it is not, at least yet. We know that some people are going to need more help than over the phone, but we don't quite have the response system ready to help today. What we want to make sure we understand is that it's not a new or duplicative infrastructure. It's been around. The National Suicide Lifeline Prevention Centers have been live, that number, since 2005. And so 988 is currently leveraging our existing networks that's already been there, although immense work has been done in the 2 years that Congress authorized 988 to kind of advocate for the number. There still continues to be a great deal of work ahead of us. Another thing we should talk about is that 988 does not take the place of 911. When we are in need of a medical emergency or fire or police, we still call 911. It's specifically for 988, so it's not replacing that. And it's also not replacing warm lines and other hotlines from community behavioral health providers around the country. Those warm lines are still open and accessible to the extent that you're not in a true crisis but need help in a behavioral health. There are many community partners here in Northeast Florida that have their own helplines and hotlines, and so we encourage you to continue using those as well. And so those are some of the things that 988 is not. And one key point is that July 16th was not the end of 988 in terms of the launch. It was only the very beginning. And so we're excited to continue to advocate and ensure that crisis care is available across the country. So I want to talk a little bit about what our continued challenges are. And those are, do we have enough trained mental health professionals to make this successful? And can the call centers operate with existing resources due to the anticipated increase in calls that we're expecting? We don't have the true answers to that. There are a great number of jobs that are going to be available in human resources, but we don't have enough licensed, certified, or otherwise qualified individuals applying for these jobs. The U.S. has experienced shortages in mental health providers, and the implementation of 988 won't change that. However, 988 does offer opportunities for new resources and funding that will support people in addressing these workplace shortages, if you will. And it's important that we advocate for these resources. We need to encourage more students to major in human services, to seek certifications in behavioral health and seek employment in these positions. There's going to be a huge number of job openings that are available just at National Suicide Prevention Lifeline centers across the nation, and those positions include on-the-job training and provide essential services to our community. So mobile crisis teams, I know we've talked a lot about that. And while they are going to be expanded here in Northeast Florida and most likely other places in the state, they're not yet available, which also means that law enforcement remains the likely in-person response for someone in crisis right now. Jacksonville has actually implemented a pilot program called the Co-Responder Unit, which is incredible. They have a one officer and a behavioral health peer licensed, I don't believe they're licensed, but a behavioral health person go out on calls that are clearly behavioral health calls. And so this definitely lessens the strain and load on law enforcement to respond alone to behavioral health calls. But right now, it is still the co-responder units that will need to go out to these behavioral health crisis calls, and that's a challenge. But I'm very proud that Jacksonville and the Jacksonville Sheriff's Office and the Mental Health Resource Center have implemented this pilot. I really favor it, and I'm really excited to see them expand that program as well. And then funding sources to be able to create Northeast Florida behavioral health ideal system that we want to create. Gayle talked about a lot of them, but some of the funding sources right now that are coming through are to increase the capacity at the National Suicide Prevention call centers alone. It doesn't address the response and implementation on the ground level to try to respond that, and it's coming down. It's coming slowly, but we need to continue to advocate for funding that's recurring and sustainable, and what is necessary for us to build the system. So how can you help? How can all of us here help in Northeast Florida? Share your story, because the power of advocacy is so important for everyone to understand. The real life experiences of people who have encountered either good or bad responses to systems is what's needed. You can email your members of Congress. You can explore how your community can reimagine crisis. You can learn about ways to influence your state and policymakers, which is to connect with the Florida Mental Health Advocacy Coalition. They have great alerts that are happening. They have a plethora of information to share. Connect with NAMI Jacksonville. As Gayle mentioned, we are starting a local advocacy group. And so your voice needs to be heard here, and so that we can continue to advocate for what we believe we need to respond. It is really an exciting time in our nation to have a 988 phone call, but we need all of us to try to take steps to advocate and to move it to the next step forward. That's it for me. I will unshare my screen.
Thank you so much. It was very nice to hear what specifically is happening in this area of Florida, to see the potential of 988. So now we're going to move on to a discussion part. If anyone has any questions, you can raise your hand, unmute yourself, put it in the chat. And if not, we have a few questions that we can go over. So we're just going to start out with one of those questions, just because we are coming up on the end. And if you have anything, or if you want to jump in, you could just do that. So one of the biggest barriers that a lot of people face to receiving mental health care and treatment is a lack of adequate insurance, either being uninsured or underinsured. And so one of the things that I wanted to see if you guys knew is how 988 will work with insurance. I know, Gayle, you touched upon it briefly with Medicaid, but will people be able to use 988 if they are uninsured, or no matter what insurance company that they have, will they still be able to access these services?
Absolutely. Absolutely. Anyone can call 988 and anyone can get de-escalation and counseling. Anyone can call a mobile response team, or 988 can connect you to a mobile response team, and mobile response teams will come regardless of your insurance. What 988 may refer you to, if they have to refer you to other services, such as therapy services, will work with your insurance. They'll ask you what your insurance is. And if you don't have any insurance, if you're completely uninsured, remember there are the managing entities in the state of Florida that provide behavioral health services to those who are uninsured or underinsured. So that they call themselves the safety net.
All right. Another point that was brought up by both of you was the role that law enforcement are going to be playing in this. So as of right now, even though 988 has launched, law enforcement still remain the go-to for people experiencing these kinds of crises. So even though 988 is supposed to be a response without law enforcement, I know there are some states, including my home state, New Jersey, that in their legislation do have caveats for law enforcement joining in for these calls. They don't outright ban them, but they do have them involved for certain situations. So for Florida, I know that there isn't any current legislation for it, but do we know what the defined role of law enforcement will be for 988?
911s are overseen by NENA, that's the National Emergency Number Association. And we are waiting on guidance to come down from NENA on whether calls can be transferred. Well, we know they can, but whether NENA says they should, whether calls should be transferred from 911 to 988 if it's a behavioral health crisis situation that does not require law enforcement. Now, if somebody has a weapon, they're about to harm themselves or someone else, then they're going to send law enforcement. And even if you call 988, if that's the situation, they're going to transfer to 911 and send law enforcement because somebody's life is in peril right at that moment. Same thing is true with someone who is actively trying to take their own life. They're going to send, you should call 911, or 988 will transfer to 911, and they'll send medical because it's a medical emergency. So that's really important to know. Some places in Florida, and Suzanne, I believe you said this is happening in Jacksonville, that within your task force, there's a conversation between 911 and 988, between your call center and the 911 PSAPs, and how they're going to work together to provide, because everybody wants to provide the best, most helpful response. Alachua County Crisis Center in that county, they've been working with their police for over 25 years, and they already have protocols in place, and they go back and forth. Yes, this is a behavioral health emergency, but we don't need to send law enforcement. This is something that we can send the mobile response team for, or we can get a counselor on the phone and they're going to de-escalate. So the idea behind 988 is that it's like air traffic control. So whatever you need 911, they can go to 911. You need counseling, they can do counseling, or de-escalation. You need mobile response team, they can do that. You need to go to a crisis stabilization center, they can send you there. So, or maybe you need to be set up with therapy appointments. So it's like I love air traffic control, or Georgia Crisis and Access Line calls it care traffic control. So they can send whatever you need. Maybe it's a peer specialist, but it's the ability to quickly triage calls. The only other thing I'm going to say, and then I'm going to let Suzanne talk, is that if you do call 911 for a behavioral health emergency and you want law enforcement to come, ask for a CIT trained officer. That's crisis intervention training, and that's a 40-hour course, and it makes a lot of difference, because then the officer understands behavioral health issues and knows how to respond.
Yeah, that is a great point, Gayle. And I actually have had an incredibly positive experience with law enforcement, Jacksonville Sheriff's Office, when we called to Baker Act a loved one. Our CIT officer was incredibly patient and caring and gentle. And so it was a very good situation. And so it is important you ask for a CIT officer. But in the meantime, as we're still building this system, we do have the manager of 911 here in Northeast Florida, and Jeff Winkler, who is Director of Basic Needs and is currently running the National Suicide Lifeline Prevention Center, which is run by United Way of Northeast Florida and combined with 211. And he's been a compassionate leader in this initiative. And so there has been some really good conversations, and we are looking at specifically mapping calls that come in. When a call comes in, there are certain assessments that happen, and then once the assessment happens, they determine whether it's lethal or non-lethal call, and at that point they determine whether to call 911 or not. And that has been in place for some time now, and so the collaboration will continue to be important. What we're looking at now is that there may be some additional calls that come in on all levels of behavioral health crisis and from family members, and what degree then do we need to rely on 911 to go out and handle that call, and to what extent until our mobile response teams for adults are put in place. And so it is a staged response, if you will, but they will continue to be very involved, and I'm just so encouraged by the collaboration that's been happening here in Northeast Florida already.
So we got a question from someone in the audience. You both had talked about the Baker Act briefly. And so they want to know how this will still, if it will still function with 988, if calling 988 will lead to this implementation, just how they'll work together, if they will work together at all.
988 should actually prevent some Baker Acts. I mean, there are times when someone really does need a Baker Act, but a lot of times they just need counseling and de-escalation and referral to services. And now we have 988, which can provide that. I mean, most people don't know that our 211s were already providing that. But now with 988, communities such as yours are working together to enhance the services and fill in the gaps. So it's given us an opportunity to what is it NAMI says, reimagine the crisis care system. But I don't think much is going to change about Baker Acts themselves. I mean, they'll still be handled the same way. I would just reiterate that, if you do need to request a Baker Act for a loved one, to request a CIT trained officer.
Yeah, there will definitely still be a role for Baker Acts. It is sometimes an important way to help somebody, get into some care they need. But the idea is that 988 will help to reduce the number of unwanted Baker Acts, if you will, and hopefully respond in a more dignified response.
Yeah, I mean, when mobile response teams go out, they're right there in person with you to assess the situation. And they're professionals, and they usually work with Baker Act teams. In Broward County, they have Broward Sheriff's Office has a special Baker Act team that the mobile response workers can call in, and then and they handle it pretty well. I mean, the Baker Act team from BSO stays a little out of the way on the street. They're not like in your front yard yelling or anything. They're very discreet. They let the behavioral health workers handle it. But then if needed, they provide transport to the Baker Act facility. Yeah. So if you go to a centralized receiving center, it's a 23-hour assessment. But if they feel you need longer to get stabilized on medications, to try some new medications, to be observed in a safe environment, yes, they can Baker Act from a centralized receiving center.
Want to just end on re-emphasizing that 988, well, it started, it's a soft launch. You both have mentioned that. Well, it has gone live. A lot of the resources that are coming through haven't been fully implemented yet. So while it is live, you might not be able to get all of the care that you need just yet for it, at least from the specialized facilities that 988 has. But 988 does create the promise of a new way of dealing with mental health problems, substance use problems, suicide ideation, or any of these problems that people might face, instead of having to go to law enforcement or the emergency room. And so it really provides a new way to handle this and a better way to handle this. I want to thank everyone for coming out. I want to thank both Suzanne and Gayle for coming. I know I've been emailing you both back and forth for a while, and I want to thank you both for showing up. You both have been a great help. You both have given me a lot of the information that I've needed to create a lot of this, and you have allowed this to become an event that we were able to hold. So I want to thank you all for that. And then I'm going to turn it over to Dennis just to close.
Thank you very much. Thank you to our speakers, and again to our interns who made this possible, particularly Giese and all the work that you did. I didn't want to put a plug in August. We're having a follow-up session. Is it August 10th, Giese?
Yes, August 10th.
And we'll have an administrator from the federal level talking about 988. So we're looking forward to hearing more. And I do agree with Giese. This is someone had a great idea to create this, because we have a crisis in mental health generally, but within law enforcement, they need options, and they need help, and this is a way to do it. And so I'm pleased about the advocacy approach, because it's going to be needed to have funding set aside for this kind of service, particularly for it to run well. So anyway, thank you so much. And everyone have a wonderful evening, and we're grateful for all the work you do to make our lives better and that of others. Thank you.